There are 7 killer mistakes that organizations make with regards to health and safety. The first is blaming workers for injuries and not coaching. You see, worker behavior can be coached to improve, but a lot of companies would rather seek fault, seek blame, and it shuts down anything that can be found about an incident, anything that can be found about a situation. It's kind of like a cat chasing its tail over and over again and getting nowhere. It's counterproductive and foolish. Blaming, get out of the blame game. Seek to find the truth, the cause, and work with your workers and coach. If the behavior is substandard, coach to improve it, coach to make it better. Be a learning organization. Point number 2, unfair discipline. I had a situation where I had a rig moving company where everybody knew that the owner's son had special privileges. And I was on a rig move with 5 safety people, and the owner's son came out without any personal protective equipment. Personal protective equipment being things like steel toes, hard hats, fire retardant coveralls. And rig moves are very, very dangerous. There's a lot of moving equipment, slippery conditions, and not one of those safety people disciplined him. So I stepped up and I told him that if he was on a rig move, like everybody else, he had to follow the rules. And that showed up in my audit report. Nothing wrecks a safety program quicker than having one set of rules for special people and another set of rules for everybody else. Point number 3, management not walking the talk. When I was employed as a district health and safety officer for a major oil field service company, I had a manager that felt that the rules did not apply to him. And he did not walk the talk. Single-handedly, he did more damage to the health and safety program's credibility and buy-in amongst the workers than all my efforts combined could do to enhance health and safety, to make sure that workers wore PPE. Often they say, why should I wear it when he doesn't? And what can you say? So you have to go after the manager and discipline him like everybody else. One of the worst situations I ever saw was a company where health and safety took a seat to productivity pressures and where incidents and injuries were simply a cost of doing business. This major waste management company had losses of over $500 million a year. They killed over 15 to 20 people worldwide. And the president of the company came out and said, oh, you know, this is terrible. We're going to reduce our injuries. We're going to have 0 incidents as our goal. And they hired a crack health and safety team that started to do just that. I gave them 6 months. They lasted 9. To this company, these terrible losses in a highly profitable industry niche were simply a cost of doing business. They didn't care. They were making such big profits that to them that overrode any health and safety considerations, any loss of life. That's unethical. It's wrong, because they could have doubled or tripled their profits if they addressed their safety concerns. let's talk about point number 5. Often I get people telling me, you know, Barb, health and safety is great, but there's such a thing as overkill. And yes, there can be overkill of health and safety, which sounds counterproductive to what I'm saying. But safety has to make sense. It's got to be part and parcel of the job skill that employees are utilizing. It cannot be so onerous to do your job that nothing gets done. I had a situation where I had a survey company and I was placed in the horrible position of disciplining when somebody working in an open field with no danger to their head had to wear hard hats. It was senseless and it destroyed their feelings, warm and fuzzy, towards health and safety. Point number 6, inadequate incident investigations. I was doing an audit of a company and there was a problem that had been gone undiagnosed for 7 years. The workers had tried to let management know there was a problem with trays, which were unstable, that they stacked their bread on. And the trays would be very, very high and heavy, and if they fell, they could seriously injure someone. And management did not listen, did not want to listen. So they told me, the auditor, and basically what happened is I told management. And instead of investigating these incidents that happened where the trays toppled over, they chose to blame, which I mentioned in number 1, shuts down everything. And they blamed a junior level manager when that manager was blamed because his supervisor reported it, and they blamed him for allowing the supervisor to report it. Not that it would save people's lives, prevent losses, and really enhance health and safety at the company. So inadequate incident investigations fixed with blame are very common. Is your organization doing that? That's one of the worst mistakes you can make. Number 7, no senior management support or worker participation. The only case, to my knowledge, and I could be wrong, that was successfully tried against a health and safety person in Ontario was this health and safety person arbitrarily creating hazard assessments, and he did them with no worker participation, and the net effect was there was no buy-in, and they didn't adequately reflect the type of work the workers were doing. You always get workers involved because they're the experts. They know their job better than anyone else, and when they get involved, have ownership in the system and the processes. And you need senior management support, not lip service. Senior management has to believe in health and safety, and they have to hold everyone accountable for achieving health and safety goals they have set, and measure health and safety at least annually through the audit process. Now, I've talked about 7 killer mistakes. If you even have one of these, please weed it out. Try and stop these before it kills your health and safety program, or worse, kills someone near and dear to you.